In today's video, we will talk about the risk adjustment coding. So, what is the risk adjustment coding? It involves using diagnosis coding to eliminate the future healthcare cost based on the patient's health status and complexity. It is used in a ICD-10 diagnosis code addressed chronic illness and conditions and calculate the risk scores to predict the future cost. So what are the purpose of a risk adjustment coding? That are ensure patient with a more severe condition and receive appropriate care and resources. Determine risk score that impact the reassemblation rate. Adjust payment to reflect predict healthcare cost. What are the common HCC categories and coding? First is diabetes E11.9, E11.65, COPD chronic obstructive pulmonary disease. And last one is the chronic heart failure. So what are the common HCC categories and coding? That are diabetes, major depression, chronic kidney disease, cancer, etc. So what are the elements for a risk score calculate? That are diagnosis coding, ICD-10 codes for a chronic and serious condition that are held to the diagnosis the specific type of a code to achieve the moderate information of a level of the disease. So next we will talk about the demographies. So there are factors involved that are age, sex, dual eligibility, diseligibility, status. Last one is the interaction that for account for a higher risk when a condition combined. For example, diabetes plus CHF. What are the importance remainder? So that are accurate documentation requirement for the specific type of a disease that are more riskable for the specific diagnosis to complete that the coding information to assess the very severe code in this, so that are accurate documentation requirement that are complete, clear and specific diagnosis documentation is initial. Next one is the annual update that are HCC must be re-evaluated each year of a risk adjustment. Compliance is crucial for the compliance that follows regulatory guidelines to avoid audits and penalty rates. What are the importance you will reminder? So that are use correct codes plus modifiers, follow prayers guidelines. So next we will talk about the short review of this coding. So we will adjust the code risking that says for the patient encounter that are a review healthcare condition. First we will review healthcare condition for a specific type of a code to diagnose the assessment of the specific disease. So next we will talk about the documentation. What are the documentation requirement in the diagnosis for a coding and billing? Assess the ICD-10 code for this coding. So next is the calculate for a risk code. So next we will talk about the types of a risk adjustment. So there are three types, that is HCC, HCPS and SCG, that are chronic illness and disability payment system for a Medicare and HC, CSIP. Next is ACG, adjusted clinical determine risk code for a higher and lower risk. That is a plan for a link to diagnose the patient disease to the specific type of a code that will assess the coding error that will be prevent the more type of a coding. So today all about this video. So thank you for watching this video.